My internet's slow. Okay, got it.
Okay.
Okay, hi everyone, and welcome back to another session with DentalShadowers. Today we are joined by Dr. Andrew Vallo, who is a cosmetic dentist and who will be teaching us more about cosmetic dentistry. Dr. Vallo, the floor is yours.
Thank you for that introduction, Desiree. And I do apologize. I am a cosmetic dentist, but I'm also a general dentist. And the presentation that I had prepared is actually on endodontics. So the first part's going to be clinical. I'll be honest, I enjoy doing root canals. Learning about them might not be as much fun, but I still think it's a really important thing to learn about. And then the second half of my presentation is actually about starting your own dental practice from scratch, because I just did that. My brand new office has been open for about a month. We've had a great first month. And so that's like my favorite topic. So I'm really excited to talk to you guys some more about that as well. And let me go ahead and pull that up. So Desiree, am I screen sharing, or do I have to do something to screen share my presentation?
If you go to the bottom of your screen, you should see a green button that says share screen. You should have access to share your screen.
Right. Oh, there it is.
There you go. Perfect.
Right. You guys can see my presentation? Awesome.
All good.
Let's go ahead and do this then. All right, everybody. So like Desiree said, I am Dr. Andrew Vallo. I am a general cosmetic family dentist. I do just about everything in my practice. Only thing we're referring out really right now is implant placement. But other than that, we're doing about everything there. So my background, I grew up in Pittsburgh, Pennsylvania. I am a huge Pittsburgh sports fan. We are the city of champions, although now I'm in Tampa and they're kind of the new city of champions. So undergrad was Michigan State, go Spartans, and then dental school was Ohio State. So that was a tough transition for me, to be honest, but I guess I'm a Big Ten guy through and through. After dental school, I went to public health. That was a good transition from dental school. It also gave me some loan reimbursement, which was helpful. But it was a really good place to help out patients that, really couldn't afford standard dental care, and to just do a lot of procedures. So, I mean, I did a lot of root canals, a lot of extractions, a lot of fillings, things like that there. So I did that in Ohio. And then after almost 3 years in it was just about 3 years in public health, I moved to Tampa, Florida. My fiance and I were just sick of the snow, and we didn't have kids yet, and I wanted to start an office. So we said, hey, if we're going to do it, now's the time to do it. And so we've been in Tampa, Florida for almost 2 years now. When I first got here, I actually almost bought a practice. That fell through. And so I decided to start one from the ground up. And I took a job as an associate. I was at like a fee-for-service practice for a little bit. They just didn't have enough patients for me. So then I went to a much heavier insurance-driven practice, and I was very busy there. And I actually just quit that associate job just about the same time as my practice opened its doors. So pretty cool to not be an employee anymore and to really just be a practice owner. Okay, so this is a sneak peek of my brand new office. We are the Dental Boutique Westchase. Our motto is luxury meets family dentistry. So we try to cater to everybody. We try to bring the patient experience to the next level. And I'll talk some more about that towards the end of the presentation here. This is just, I guess, a quick insight into some of the stuff I like to do. Again, I do like cosmetics. I do like trying to be conservative when I can and helping patients out. And so I think that's, just a big pearl, is just because there's a big cavity doesn't always mean we have to go to a crown. As long as we've got some nice tooth cusp left, we can really do just a nice big filling in there, and we can make it look nice and aesthetic for them as well. And that should last them a long time as long as they're taking care of it. So go ahead. Okay. So we're getting into the meat of the presentation now. Like I said, this presentation is about root canals. I do enjoy doing them. Not all general dentists do root canals. I think it's an invaluable service for your patients. So when a patient comes in, they have a toothache, they want to save the tooth, rather than have to send them to the specialist and bring them back for the crown. you can just get everything done at once. And patients really appreciate that too. So what's a root canal? Endo is the Greek word for inside. Odont is the Greek word for tooth. So endodontic treatment means treatment inside of the tooth. I gotta figure out how to move this a little bit. It's blocking my slides. There we go. So root canal treatment involves removing infected pulp tissue, cleaning, disinfecting, shaping the root canals. And we do put a special sealer and filling material in there to prevent bacterial invasion. Root canal myths. Number one, it's going to hurt. Patients typically actually experience less pain during root canals than during a tooth extraction. Post-op's also usually easier. So that's a nice thing to tell patients if they come in and they object, hey, I heard root canals really hurt. You tell them, as long as I'm doing my job and I get you nice and numb, you're going to be very comfortable throughout the procedure. So, all right. Myth 2 is root canals make me sick. Again, patients have heard things that root canals aren't good for you. And I've heard everything from they cause cancer to they make your teeth fall out. Truth is, there's no valid scientific evidence linking root canal treatment to disease elsewhere in the body. Much of this myth stems from disproven, poorly designed research studies conducted nearly 100 years ago. The third myth is root canals always fail, so why should I get one? You know, the truth is, when I talk to patients about options, because when their tooth needs a root canal, there are options. The option is we do the root canal, we do the crown, we try to save the tooth, we try to preserve it, or we take the tooth out. Root canals are kind of the last ditch effort to save the tooth. So I tell patients that, hey, you know, they can fail sometimes. We're taking away the nerve, we're taking away the blood supply. But most of the time they actually succeed and they can last a really long time. So, you know, again, the important factors are making sure that they actually complete the root canal as soon as possible following diagnosis. Chronic infections can actually lead to deterioration of bone. And very large infections, the likelihood of a successful outcome are a lot lower. Having the permanent restoration and crown completed at the time of or soon after the root canal is finished, and regular dental recare, including cleanings and exams. Canals are like a box of chocolates. So the cool thing about root canals is, you know, every tooth is different and it can be different inside a patient's mouth and from patient to patients. But we do have some good rules of thumb. Anterior teeth, incisors and canines typically have one canal. Upper premolars can have one or two, and lower premolars typically have one. Molars can have 3 or more canals. And that's just a little chart kind of showing some of that stuff. It all starts with that darn dam. Rubber dams are the standard of care when it comes to endodontic procedures. Personally, I like the Relax Fit Insti-Dam. It comes pre-assembled, so you don't have to assemble the dam on the frame. It's a lot quicker, it's easier, and it's actually more comfortable for patients just because of the shape of it. It stretches a little bit easier. But that's that right there. You can use a traditional dam and frame as well. Clamp it up. All right, so the clamp holds the rubber dam in place. We tie a piece of floss through one of the holes in the clamp. This way, if the clamp's dislodged and falls back towards their throat, it can be retrieved. And the best way to handle an emergency is to prevent it. Access openings. After the rubber dam is placed, the next step is to create the access opening. So that's where we're actually going into the pulp tissue, the nerve of the tooth. And once we clean out the main chamber, then we start accessing the nerve canal opening. So this is a nice access tooth. You can see the different 3 nerve canal openings there. And above that would have been the pulp chamber, or the main portion of the nerve of the tooth. And looking over here, this is just kind of showing it. This is the pulp chamber, and there we've got the nerve canals below it. File lubricant. So lubricant should be used on all hand and rotary files. Personally, I use ProLube. They're single-use carpules. You open them by tearing off the end, and you use one for each root canal patient. Basically, it just helps the files slide in and out of those canals easier and helps prevent the files from separating. All right, so initial working lengths. After the pulp's removed, the Endo Explorer is used to help locate the canal openings. The first file used for most root canals typically is the purple size 10 hand file. You know, everyone might do it differently, but that's a good starting size. Sometimes the canals are very small, and we'll start with an even smaller, like a size 6 or size 8. That's what they look like right there, those purple size 10. The white size 15 hand file is the next one in the sequence, and I usually take my working length x-rays with the white 15 file in place. If you have a tooth with multiple canals, especially if it's a buccal and a lingual canal, I'll usually put a size 10 in one of them and a size 15 in the other. Just makes it a lot quicker and easier to figure out which file is going where, because they're different sizes. And there's the 15 right there. All right. So that initial working length x-ray, that film's exposed with the small files in place to verify the working length of each canal. Once we get that x-ray, you know, we can take a look and see if we have to make any small adjustments. And for this initial working length film, it looks like they got everything just about spot on. So that's always nice when you're right where you need to be. I had mentioned earlier a chronic infection. This is a tooth that has had an infection for a long time. So, you know, all of that dark area there, that's all bone that has been compromised because of that chronic infection. And this is one of those times where you tell the patient, you know, hey, this definitely can still work, but because of the extent of the infection, prognosis does go down a little bit. So, you know, when you see a chronic infection like that, that's when you start thinking more about, hey, maybe it makes more sense just to remove this tooth. But at the end of the day, I am all about saving teeth. And so if I think we can predictably do it, you know, that's always my recommendation to patients. Wave 1. All right. So after we establish the working length, we move on to larger size files. In the past, those poor dentists had to do everything by hand. It took a long time. You got arthritis in your wrists. Now we have rotary and reciprocating handpiece systems, and I personally use the Wave 1 reciprocating system. In my opinion, it's the best. I mean, I've tried a bunch of them. Obviously, everyone is entitled to their own opinion, but I really like the simplicity of it, and it works really well. All right, so this is kind of a look at the system I use here. We've got the Tulsa 8-to-1 mini head contra angle handpiece. That means that the handpiece is operating at 1/8 the RPM of the motor. And we've got the ProMark motor over here. We've got the motor plug-in, power cord plug-in, on-off button, foot pedal plug-in. Pretty simple stuff. Okay, so the settings for Wave 1, they're auto set when you first purchase the motor, so you don't have to set anything up special. When you turn on the system, all you have to do is hit preset number 2, and it has your settings for Wave 1 already selected. A good thing to look at just to make sure that you do have the right setting is because it's reciprocating, the file is going both forward and backwards. So we want both the forward and reverse buttons lighted up on the settings there. All right, the file sizes for Wave 1. So there's 4 styles of Wave 1 files ranging from the small yellow to the large white file. The small yellow is a size 20, and the large white is a size 45. Sometimes you only need one file. You know, honestly, a lot of times you only need one. So if it's a, let's say it's like a lower premolar, it's a single canal, typically either the yellow 20 or the red 25 is going to be all you need. And you just go right to the size that you need there. You don't have to go through the order of all the different files. So that's nice. The files are single use. They are disposed of in the sharps container after each root canal procedure. You do not want to reuse these files because it greatly increases the likelihood of them breaking, and it's not fun once a file breaks in a canal. All right. Irrigation. So irrigation is a 3-step process. The first step is with the sodium hypochlorite. This only dissolves the organic material. It cannot remove the smear layer. So we put the sodium hypochlorite in the canals. We let it sit for a few minutes. And then after that, we rinse really thoroughly with water. And then the third step after we rinse the water is the Q-mix. It's EDTA and chlorhexidine. So it's a mixture, and it chelates the calcium ions and the dentin, and this is what removes the smear layer. So if you go through this, not everybody does it the same way. Again, I have found this to be the best way to do irrigation. and it really helps to sterilize those nerve canals and make sure that you don't have any complications following the root canal. And that's just what that Q mix looks like. Absorbent paper points. So after we finish the irrigation process, the canals do have to be rinsed again and then dried very well. First, you want to dry with a lot of air. So if you spend like 20 seconds just blowing the air down the canals, it greatly reduces the amount of these paper points you have to use. The nice thing is with the Wave 1 system, everything is color coded. You use the same color for everything. So if you ended on a size 25 red file, you're going to use the size 25 red paper points, and they're fitted perfectly for the canals. You're usually going to use at least one pack of paper points for each canal, but not always. All right, for the sealer, we use that to fill the small spaces between the root canal filler, which is the Guttapercha, and the canal wall. You only need a really small amount of that. So it's about half the size of a pea. You can kind of see that there on your fingertip. That's about all the sealer you need. Guttapercha. So Guttapercha is the root canal filling material, like I just mentioned. It is named for the Malaysian Guttapercha tree that it actually comes from. So sometimes patients do ask, oh, what is this stuff? Like, where does it come from? And you're like, oh, it's from a tree in Malaysia. So that's always kind of cool. That's what that tree looks like. It's both biologically inert and biocompatible, which makes it an ideal permanent endodontic filler. And another nice thing about the Wave 1 system is that the Guttapercha are custom fitted to match the Wave 1 files exactly. So you still use the sealer, to kind of seal it up. But almost always it's one Guttapercha point for each canal. Again, old school, we didn't have these perfectly fitted Guttapercha, and you had to use these accessory points, and the whole process just took a lot longer. So that's another reason why I love the Wave 1 system. I promise you guys, Wave 1 is not paying me anything for this presentation. I just really like it. I wish they would. Maybe we should talk to them about that. All right. So this instrument's called the Glick. It has a plugger end and a paddle end. It can be heated up to sear off the excess Guttapercha, and the plugger is then used to finish condensing the remaining Guttapercha. And so that is like the last step in the root canal. So this is the point where you can tell the patient, hey, like light at the end of the tunnel, we're finishing everything up here for you. So some teeth do have very large nerve canals. As I mentioned, the Wave 1 system only goes up to the size 45 white. These large canals are usually found in the maxillary anterior teeth of younger patients. So we're looking at those front 4 teeth, especially when we have these canals that are bigger than the size 45 file, we do have to go to the larger hand files and matching Guttapercha for those cases. Sometimes we can go up to like size 80, 90, even 100. They actually do get more complicated, even though it's a lot easier to find the canals. When they get to be the very large sizes, it actually takes up a lot of the tooth. So you don't have a lot of surrounding tooth structure around the canal. And to really get a good fill with those large canals can be tough. So sometimes in very young patients with very large canals, it does make sense to actually refer those to the specialist. So there is kind of a cutoff point where, hey, maybe this isn't a great case for the general dentist to take on. And that is a good transition into case selection. This is the most important part of the root canal process, is knowing which cases to take on and which cases to punt to the specialists. I feel like the specialists probably hate general dentists like me who do most root canals, because the ones that I send them are the ones that they don't really want to do either. But anyways, major indications for referrals include abnormal anatomy. We had mentioned the very large canals. Sometimes they're very small canals, and sometimes they're even calcified canals. So if you look at an x-ray and you can't even begin to see the nerve canal, that is not a root canal that you want to take on. And here's some examples. In this case, we're looking at tooth number 20. In this case, we're looking at tooth number 29. And once again, in this case, we're looking at tooth number 29. So tooth number 20, this is a very straightforward, normal anatomy looking nerve canal. This is a home run case. You get that and you're good to go. Let's see. Yep, there we go. Tooth number 29. This is a very difficult nerve anatomy. So we have one large single canal. And when you get down about halfway down that tooth, if you can see, that canal is splitting. So to try to navigate the split, if it splits near the very top, no problem. When it's halfway down the tooth, sometimes it's 2/3 the way down the tooth. That's a very challenging case. That is not a case you want to take on. So again, just seeing that x-ray, immediately noticing what's going on with that anatomy, and just knowing to tell the patient, hey, you've got a very difficult tooth anatomy. It's going to be best served by the specialist. It's just going to save you and the patient a headache there. And then in this case, tooth number 29, I was talking about not even seeing the nerve canal. If you look at 28, this one, it kind of tapers off the end. You can't really see the very end of it too well, but you can see the beginning of the canal. I mean, I don't know about you guys. I really can't see anything here. So that is not a root canal that I would be doing at my office. All right. All right. So this was a somewhat recent case I had done. There's a pre-op photo. So we've got a tooth with recurrent cavity under a very large existing restoration. X-ray is a little fuzzy here. I think I took a picture of the computer screen, so it didn't show up that well. So it is a little bit tougher to see the canals, but you can kind of see them here. When you look at it on the computer, you can see them a little better. They are smaller. I mean, it was one of those tougher cases, but in the end, it turned out really nicely here for us, and we had a happy patient. All right, so that wraps up the clinical portion of tonight's seminar. This gets into the more exciting portion, which is starting a dental practice from the ground up. So how did I get here? When you graduate dental school, you get a lot on actual dentistry, and you get a lot less on the business of dentistry and starting an office or buying an office. So I really sought out other ways to learn how to do this. Podcasts and books are a great place to start. Some of the best dental podcasts that I would recommend are Bulletproof Dentistry, and then also Shared Practices. There's a bunch now. The Dentalpreneur is a good one. Dental Practice Hero is a good one. So I mean, there's a lot of dental podcasts out there, but I think Shared Practices is probably the best one for learning about practice ownership right now. Dental Facebook groups, I mean, those are huge. There's 2 different dental startup Facebook groups. I'm in both of those. Dental Nachos. I think dental students can even be in Dental Nachos. The Business of Dentistry, Nifty Thrifty. I mean, there's probably a dozen good dental Facebook groups. So start looking for ones you can join as a student. But as soon as you graduate, try to get into all of them and, contribute and just look at what other people are posting and things like that. My failed acquisition. So I mentioned I was going to buy a practice. Basically in the 11th hour, the sellers walked away. It was frustrating. You spend a lot of money in research trying to acquire that practice. And when the deal fell apart, it sucked. But it gave me that kick that I needed to do it myself. And, honestly, looking back, things happen for a reason. And I think I'm a lot happier with my own practice, where I got to have my vision from the very start versus buying somebody else's practice and trying to transform it into my vision. I began the practice of this startup in June of 2019. So that was the acquisition failed in May of 2019. And the next month I said, all right, I'm going to start my own practice. And I started looking for real estate. It's a long process. I mean, I opened my doors April 13th of 2021. So, I mean, it was almost 2 years of planning to get here. Recommended reading and listening, books, Obstacles Away by Ryan Holiday. That's just a fantastic book about dealing with life's challenges and the right way to deal with things. The Fred Factor, that's all about taking customer service to the next level. The E-Myth is about being a business owner, versus being an employee in your business. Relentless by Tim Grover. He was the trainer for Michael Jordan and Kobe Bryant, and just talks about that winner mentality and what it really takes to be number one. So those are some great books I would recommend, even though most of them aren't actually dental related. There's an E-Myth dental version But none of these books are actually dental specific. Still highly recommend all 4 of them. Podcast I mentioned already, Shared Practices, Bulletproof Dental, Dentalpreneur. So where do you start when you want to start a practice? Most important thing is to bring on the right team. I think some people get in the startup mindset and they think they have to cut corners and save money and pinch pennies everywhere possible. And that's about the worst thing you can do, because you don't know what you don't know. And that's how you can start making some very, very costly mistakes. So spend the money, even when you feel like you don't have it, get the right team, get a dental specific attorney, get a dental specific CPA, a medical dental specific commercial real estate agent. You're going to be working with equipment reps. You don't have to necessarily buy all of your equipment new through them, but you still want their help on the project. Contractor. I was dental specific for the contractor. You don't necessarily have to be, but once again, if they don't know dental, they don't know what they don't know, and they may miss some things that you really need for a dental office. Lender, big banks, are usually the way to go. Sometimes you can get a loan from a small local bank. I went with Wells Fargo. There's a lot of red tape, but they gave me the best rate possible. And consultants, you don't necessarily have to use a dental startup consultant. I decided to, and I think it was a really good decision. I don't think I would be where I am at 1 month plus into practice ownership if I hadn't used a startup consultant to do it. Will the banks lend to me? So here's what banks are typically looking for. They do want some work experience after dental school. If you don't have at least 1 to 2 years of experience, it's a lot tougher to get a loan for a startup. Honestly, my recommendation, as much as I wanted to be an owner when I graduated, I think it would have been tough. The first year or 2 out of dental school, there's just a lot. And I mean, the first thing you're doing is just really getting your speed up, getting just more comfortable with all these procedures that you might not have gotten to do as much of as you'd like to in dental school. Trying to take on the business at the same time, that would be really tough. People do it. Some people are very successful at it, but I would recommend those 1 to 2 years anyways. Liquidity, you want to save as much as you possibly can in those first couple of years. When I first came out, I was trying to pay off a lot of my student loans as quickly as possible. Then I realized, hey, I want to start a business. I need to have liquidity. And I bumped my student loan payments down to the minimum that I could. Is it going to cost me a little bit more in loan payments in the long run? Yeah, absolutely. But I was able to save up a lot more money so that I felt comfortable spending the money that I needed to spend to really have a successful startup from day one. Business plan. The banks do want to see a business plan for your startup. If you hire a consultant, they'll probably do the plan for you. Otherwise, you just basically have to write up a plan about how your business is going to run and how you're going to be successful. Good credit score, that's definitely important. Do everything you can now to improve your credit. Open more credit cards, start using them so you have more credit. But I mean, that's definitely important as well. Finding the perfect location. So there really is no perfect location. You're going to sacrifice something in the process. But you got to decide what's most important to you. For me, livability and commute time was important. I had been doing an hour and 15 minutes each way when I was in public health. I did that for about 3 years. It got old very quickly. I decided I didn't want to have a long commute, but we also wanted to live in the area that we wanted to live in. So I'm essentially a hometown dentist. This is a picture I took right outside the parking lot of the office that I'm in. I am in a medical building. It's working out very well, actually. We've got a lot of people coming in that see doctors, OBGYNs in that building, and they kind of say, oh, you're the new dentist, can I make an appointment type of a thing. That's 2 miles down the road from my house. I mean, when I go for jogs, I run by it, ride my bike by it. It's a 2-minute car ride. So I love that. And I'll tell you what, looking back over the process of the startup, you make so many back and forth trips from your house to the office, bringing supplies. And I mean, I had like 2 guest rooms full of boxes that I was stocking up before construction was done, and just bringing all that stuff back and forth. It's really nice to have an office that close. You're looking at competition, not only the number of dentists in your area, but the quality of those dentists. Are they well-established dentists that aren't really even taking new patients? They don't really have a website. They don't really have Google reviews. They're more old school. If that's the case, I mean, that dentist isn't really a huge competition to you. But if you're in an area that has a lot of practices that are newer, 10 years out, they're still growing. They've got a great website. They've got a great Google, review presence. They're advertising locally. I mean, those practices are going to make it a lot tougher for you to attract new patients for sure. Demographics, what type of people live in your area? Are they younger? Are they families? Do you want to see kids? What's their income level like? These are all important factors for sure. Is this area an area that has a specific, large population of an ethnicity of a language you don't speak? I mean, there's little things you might not even think about that you really have to consider. Visibility. And again, so life's a trade-off. The nice thing about my medical building, it is right on the main road, right in the middle of our town, right between all the neighborhoods. There are no other buildings for about a half mile in either direction. There's just houses. So that's great. It is just a little bit off the road. And a lot of people, if they don't go there, they almost don't even know it's there type of a thing. So I did give up a little bit of visibility, available space. You want to make sure you have enough space to grow into. I think my number one recommendation, if you're going to do a startup, is don't try to squeeze it into a small space. You do not want to go through everything it takes to start an office if you're only going to have room for 2 or 3 treatment rooms. So, my space, I've got 7 treatment rooms. I would have loved to have even more. But as a startup, it gets expensive to get a space that's big enough, to hold more than that. My space is about 2,300 usable square feet. So we squeeze those 7 treatment rooms into that space. So you found your perfect space. What's the next step? You've got lease negotiation, legal review, then you sign your lease, you fund your loan, then you do the floor plan design. My consultants, they did the floor plan design for me. I think they did a really stellar job with it. But make sure you get somebody who knows dental floor plans, because you need to be efficient. You want to have flow. You want your sterilization area to be right in the center. You want the break room and your private office kind of tucked somewhere in the back. You want the bathrooms to make sense. So just like every little aspect of that floor design is really important. Permitting is a huge pain in the butt, especially if you're in certain areas. So Hillsborough County, I'm in Tampa. I think it's one of the worst areas in the country. I guess I heard California is pretty bad too. It took us 6 months to get our permit. So we were told it should take 2 to 3. We were expecting to open our doors right around the Christmas holidays, and it took 6 months. So that pushed us back, almost 3 months. Just prepare for that, realize that you can have your timeline, down to a T, and things don't always go according to plan there. Other recommendation with permitting is if it's going slow, start calling the permitting office every day until they're annoyed with you, and then finally just push your permits through. That's what eventually got it done for me. So basic floor plan considerations, who's doing the floor plan design. Again, you want someone who has experience with it. I would not recommend using a dental supply company, because guess what? They want you to spend money, and they're going to design things that are going to cost more money for you, like expensive cabinets, for instance. Less is more. I went with a modern minimalistic look. You do not need a whole plethora of cabinets in your office. I have basically the minimal amount that you possibly could have, and I've got some cool organizational things in it as well. Office flow, we talked about that. Sterilization, where everything's at. Second entrance. So when I first leased the space, this was just a wall. I had to get in the lease if they would allow me to do a demo for another exterior door, because I needed to have a second entrance to my office. I mean, I guess maybe I didn't need it, but I really wanted it. It's nice for the team, myself, to be able to come through that back entrance. It's right by our surgical suite in the back of the office. So if a patient, has a mouthful of bloody gauze, it's nice for them to be able to walk out the back and not have to go back through the whole office, by all the other patients there. And again, plan for the future. Even though I have 7 treatment rooms, I only started with 4 of them, equipped. I'm hoping to get a 5th one going soon. But just because you won't need all 7 in the first 6 months or first year, you want to think about, hey, I've got a plan for growth, and I want to be able to grow into this space. You don't want to be 1 or 2 years into your startup and realize you don't have enough room, and have to move locations or something, because that really is not a good option. Designing the patient experience. So I don't have a waiting room. I have a patient lounge. Nobody likes to wait. Don't call it a waiting room. But, again, we're trying to take things to the next level. We're trying to be the Nordstrom of dental offices. We're trying to provide an extra service. And that lounge is it's really inviting. It is kid friendly. Again, you have to decide if you want to see kids. Kids can be tough sometimes, but guess what? A lot of times the parents will book the kids before they book themselves. If they come in, they see your office, it's awesome. They meet your team, they're great. Their kid has a good experience. That's when mom and dad book their appointments. So being kid friendly is a huge advantage, especially as a startup, when you need to get butts in the seat. So we do have a retro video game station, which is actually really cool. It's got a Super Nintendo, an N64, the video games I grew up playing, and that's what the kids get to play when they come to my office. So I love that. We've got a toy station. So we've got a tower of these 4 different toy machines. At the end of their appointment, kids get a tooth token. They get to go over and pick which toy machine they want to get a toy out of. They love that. We've got a cafe menu and a comfort menu. So when patients first come in, they get checked in, they get a tablet, they get to select their, beverage of choice. We've got an espresso machine. They get to select things like cappuccinos, lattes, espresso shots. We've just got regular coffee, tea, sparkling water, La Croix, or however you say that. Patients love that stuff. Just those little extra, amenities mean a lot to people. We've also got a comfort menu. So we've got noise canceling headphones. We've got like the softest blankets I could possibly find on Amazon. We've got lavender and lemon hot towels. We've got a towel warmer that keeps them warm. We've got little mini like lip balm things because patients' lips get dry during appointments. We've got blackout eye masks for patients that don't want to see what's going on. We've got TVs on the ceiling that have Netflix, and the headphones sync to the TV so patients can listen to, whatever they're watching. Again, all those little things, and letting patients design their menu on the tablet. So when they come in, they can pick the things they want. It's just like, it's a really cool experience. And we're seeing, mention of that in our Google reviews. Technology. Once again, you're a startup. It's scary to spend money, but you are already spending a lot of money to make this beautiful new office. Get some of the technology that makes things easier for patients. I got a scanner. Every new patient that comes in, they get a 3D scan of their teeth. It shows them an Invisalign simulation so that, what their teeth would look like after Invisalign. That's really huge. It also means I don't have to take impressions on my patients, which is really cool because patients really hate those goopy impressions. So when we're doing a crown, we just scan the tooth and it goes right to the lab. Anyways, it's just something where it was scary to buy that right off the bat, but I'm really glad I didn't, and patients really love it. This is like basically all the cabinetry I have. I've got one of these in each operatory, and I actually designed that myself. So I could really make it as efficient as possible. Building your brand. So if you're going to do a startup, you have to be ready to hustle. You have to grind, and you have to put yourself out there. This is myself and my fiance, Dana. We've done a whole bunch of giveaways, and I mean, you name it. I didn't have an Instagram before I started playing this office. I made an Instagram. We're on Facebook. We're doing Instagram marketing, Facebook marketing, videos, ground marketing. Just last weekend, we did a local market. I brought 2 of my team members there. Dana was there. We had a big sign. We had a gift basket we were raffling off with an electric toothbrush. We had goodie bags with, toothbrush and toothpaste and floss. We brought one of our toy machines from the office. So kids were dragging their parents to our booth, even when they didn't want to come. We had a water bowl for the dogs because lots of people bring their dogs out there. When you're the dentist, let me give you a tip. People do not really want to come to your booth. They want to go to the cool, artsy, crafty booths. They want to go eat and go to all the food booths. They don't really want to go to the dentist booth. So you've got to go out of your way to really attract people and make them want to come over there. Business to business. I mean, we've gotten very involved in the Chamber of Commerce. I've gone business to business and talked to business owners, just community involvement, charity. We are partnered with the Humane Society of Tampa Bay. And that's something I'll talk about a little bit more later, but that's probably my favorite thing that we do. SEO website, it's important to have these online presence these days. When I first had my website built, it was back in October, I think. We were like on page 6 or 7 on Google. Nobody was ever going to find us. I checked this morning. We're up to position number 6 on Google on the first page. So we've come a long way in those last 6 months. We've already got 104 Google reviews. So just asking patients, for providing the experience that patients want to write a review, and then telling them, hey, we're a new business. Would you write us a review? Especially if a patient says something to you like, oh my gosh, this is the best office ever. Just stop and say, would you write that on Google? Like, would you do me a favor and write that on Google? And patients like, oh yeah, I'll do that. No problem. Local associations, I mentioned Chamber of Commerce. I'm also I'm the dentist for the Tampa Bay Business Network. There's all kinds, there's Rotary clubs, there's BNIs, just get as involved as you possibly can. It's a full-time job. I mean, you're the employee, you're the dentist in the office, but when you're not there, I mean, you got to be prepared to work and put in the effort if you want to grow quickly. Who to hire and when? This is my recommendation. And actually it's even changed since I first made this PowerPoint, because I made this before I even opened. When you talk to consultants, especially bank consultants, when you get your loan, Wells Fargo makes you talk to their dental consultant at the bank. They're going to tell you to go lean and mean. They're going to say one person up front, one person in the back, no dental hygienist. I strongly disagree with that notion. I told them up front that I disagree with that notion. I was not going to listen to what they had to say. Here's why. If you want to be one of the average startups that takes years to be profitable, has very slow growth, and do exactly what they say, unfortunately, if you've got one person up front, one person in the back, and you're the hygienist, you can't really do much dentistry, and you can't really get that many patients in. So it's really tough to grow. Not to mention, I'll be honest, I've done maybe one like legit dental cleaning since dental school. Who do these patients really want doing their cleaning? Do they want me doing their cleaning, or do they want the hygienist who's been doing it for 20 years? We've got an amazing hygienist. She is worth every single penny. Our patients love her. So, from the start, we had a front office administrator, 2 dental assistants actually, and our hygienist. And I recommend starting the application process. Put your ads out there 2 months ahead of time. It takes time to find, the right talent. You don't want to hire just anybody. I mean, attitude's important. You want some experience. You don't want a brand new dental assistant, brand new hygienist, someone who's never done front office before from the start, because you're really relying on the small team. Again, it's scary. You don't have any revenue yet, but spend the extra money, get someone who's talented, get someone with a great attitude, a great personality, someone who shares your vision, who shares your passion for the startup. It's going to make all the difference in the world. So plan for the best, prepare for the worst. All right. So, you can do everything I just talked about. You can work your butt off. You can put yourself out there. You can do videos. We had a VIP list. So I had, from these giveaways and stuff, I had names, email addresses, and phone numbers from over 500 people. In my naive mind, I thought, okay, maybe half of them will schedule appointments, 40%. That's still amazing, before we even open our doors. I think from that list of 500 people, we got about 50 patients. So it was about 10%. It was lower than I thought. So, we had to bring in patients from other sources. You have to adapt quickly. If one form of marketing is not working, change it. I try to do all of my Google and Facebook ads from the start. I thought I was savvy enough to figure that stuff out. I could do them. I got some traction, but my conversions weren't there. Eventually I realized you got to spend the money. It's expensive to pay marketers to do that stuff. But guess what? When they're bringing you in 10 patients a week and you were bringing 2 from that same marketing campaign, it's worth it to pay them to do it. So anyways, you want to plan to have your associate right up to the time you open your practice. Ideally, have the option to go part-time. My associateship was kind enough to give me that option. We just got busy so quickly that I couldn't stay on there. So, savings, again, save as much as you can. Have enough in savings that you feel comfortable dipping into your savings to pay for some stuff early on in the practice, because your loan may not go for everything. Be prepared with the savings that you may not take out a paycheck. Even if things go well, you might not take a paycheck those first 6 months. So, have enough in savings. You feel comfortable living off that. Credit, open as many credit cards, personal, business, as you can. Up that credit limit. so that if you have to put stuff on credit 1 month because you're waiting on insurance payments and things like that, you're not going to be stuck. And again, your loan, some people will try to take out as little as possible, thinking, oh, I don't want this big loan hanging over my head. I recommend the exact opposite. Take as much as the banks are possibly willing to give you, especially when rates are as low as they are. I mean, I got a 3.4% on my startup loan. That's amazing. I would have taken another 100,000, 200,000 if they would have given it to me. So right now, typically the most you're going to get is 600,000. Most banks are between 5 and 6, but 6 is usually the limit, for a startup. So I would shoot for a bank that's going to give you all 600,000. Is it worth the grind? That's $1 million question. I'll be totally honest, guys. I have been working 100, 120 hours a week, basically for the last 3-4 months. I work 7 days a week. I only see patients 3 days a week, but when you're not seeing patients, you're doing all kinds of stuff that you couldn't even imagine. So you have to be willing to put in the work. That said, we're only a little bit over a month open, and I'm starting to take my foot off the gas just a little bit. I'm starting to take a break here and there. I spent the afternoon hanging out at our pool yesterday. So it's not forever. Just realize it's temporary. But if you want to have a successful startup from day one, you have to hustle. You have to grind. You have to be willing to work whenever. We've got these Facebook ads. I get messages from patients 7 days a week, sometimes at night. If you want them to book an appointment, you got to message them back as soon as possible. So it's like, there's things like that it's like, you have to have your priorities in check, and you have to say, this is my brand new business. I'm putting everything into it. And, failure is not an option. I'm going to do whatever it takes, and I'm going to make this thing successful from day one. So anyways, design with intention, have that passion, get your vision into the whole process of it. Freedom, I had a great job as an associate. It paid, very well. But you don't have the same freedom. Once you're a practice owner, if you decide, hey, my son's baseball game is more important than seeing practice or seeing patients this evening, it's their championship game, you can block off the schedule and reschedule those patients. Not very easy to do that when you're an associate. Growth, when you're an associate, there's kind of a maximum ceiling that you're going to hit. You can only work so many hours, and you can only produce so much per hour. When you own a practice, there really is no ceiling. You can grow your practice. You can expand to a bigger building. You can bring in associates. You can open multiple locations. If you don't want to do dentistry anymore, you can eventually get to the point where you're not really doing dentistry and you're just, running a business. So there are so many different avenues you can take once you become a practice owner. Impact. Again, this is the most important thing, but you can have a really big impact in your community when you're a small business owner. You can partner with charities. And it really makes it that much more worth that grind. This is a quote I really like. Discipline is just choosing between what you want now and what you want most. So, you can have that easy associate job now where you go home and you don't have to think about it anymore. You have your weekends off, but you're going to be doing that same associate job for the next 30 years. Whereas if you put in the extra work now, it can really change your life for the better, down the road. So this is our charity that I was talking about. We have a program we started at our office. It's called No Hungry Pets. We are partnered with the Humane Society of Tampa Bay. And what inspired this is our rescue dog, Samson. I chose this picture. This is actually not Samson. This is our other dog, Ruthie, but I really like the picture of her wearing our shirt there. So I put that on there. Samson is about twice her size. They're both doodles. She's a golden doodle. He's a labradoodle. Ruthie, we just got from a breeder. She was our first one. She is 7 now. Samson's 5. We adopted him. He was 18 months old when we adopted him. We were already his third owner. He had already been taken back to the shelter twice. He was really underweight, really malnourished. He was missing patches of hair. I just think, unfortunately, the first couple people who had taken him on either weren't ready for a dog. Actually, we found out one of them had 12 dogs. So I guess the 12th was just the one that broke the back. But he was not getting enough food, I don't think, at that house. And so with our business, we said, let's help dogs like Samson. And so what we committed to do is for every new patient, we are actually donating an entire month worth of food to a hungry animal at the Humane Society. In our first month, we saw over 100 new patients, which means over 100 months of food that we could donate, which was really, really cool. All right. So guys, that's it. I welcome you. So this is an old slide. I welcome you to follow our journey now that we're open. You guys can follow me on Instagram. You'll see all kinds of stuff from the office, from our patients, from our team, from my dogs. I'm at dr.andrewvallo. I also welcome you to follow us on Facebook. That's the office's Facebook, at the Dental Boutique West Chase. And check out our website. We're www.westchasedentalboutique.com. That's about it. So I will open the floor to you guys. I hope you enjoyed the presentation.
Awesome. Thank you so much, Doctor. Our first question is, what is the residency program details in order to do cosmetic dentistry?
All right. So in order to be a cosmetic dentist, the requirements, there really are none. You don't have to go to a residency to be considered a cosmetic dentist. You just have to want to do cosmetic dentistry. So could you do a residency? Absolutely. I guess I didn't mention in the other slide. So I'm very involved in dental organizations. I take a lot of dental CE. Learning does not end when you graduate dental school. It really just begins. So I'm a member of the American Academy of Cosmetic Dentistry, a member of the American Academy of Clear Aligners. I'm a member of our local North Tampa Spear Dental Study Club. We actually have a meeting Thursday night. I'm looking forward to that. All the different American Dental Association, Florida Dental Association. So just be involved, take CE, learn from other dentists, learn techniques, learn from the Facebook groups. There's groups where people will post like pearls about different techniques to do stuff. But if you really enjoy just changing people's smile, making them fall in love with their smile again, you're a cosmetic dentist. That's really about all there is to it. So.
That's great. Our next question is, since you see children as well, did you have to also go into pediatric dentistry?
Nope. So once again, this is the great part about being a general dentist. And nothing against specializing. There are people that just really find their one niche and they love that and that's all they want to do. That's great. But if you're like me and you like to do everything, it's great to be a general dentist because you can literally do everything. You can, without even doing traditional braces, you can get into Invisalign, and help straighten people's teeth and help prevent them from chipping and help prevent perio issues. There's a lot more than just cosmetics that go into Invisalign. You can do cosmetic dentistry, you can do pediatric. When I was in public health, we saw a lot of kids there. So, that was a good way to get your feet wet. But once again, you do not have to go into any specialty program. You do not have to go into any residency to be able to do these things. My take on residency, you'll hear different things. I think just like associate jobs, there are great residencies and there are poor residencies. So if you're going to go into a residency, find a great one that's really going to give you a lot of experience with, more complex procedures. Find one that does implants, something like that. Find one where you're going to get a lot of molar endo experience. But honestly, you can find a great associate position that's going to do pretty much the same stuff. So the drawback to the residency is, you're not really making much money while you're there versus you come out of dental school, you find a good associate position, you can make a lot more money right off the bat. But if you want to learn, you either have to take CE outside of your job, or you've got to find a dental associate position where there's a dentist there who's really wants to take you on and mentor you. So, it can be tough, but again, there's residencies out there. I have friends that did residencies that wish they would have just come out and taken jobs because they didn't learn any more of their residency than they could have had, on a job. So.
What part of your dental career did you find out that you wanted to start up your own practice?
So before I even started dental school, I knew that I wanted to have my own practice. I've always been interested in the business side of things too. I didn't know for sure I wanted to start my own. I had kind of gone back and forth, honestly, the last 5 years, thinking about which way I wanted to go. The main reason why I was going to buy a practice rather than start a practice was because I was doing it in conjunction with my move from Ohio to Florida. And I knew it takes a long time to open a practice. So, I didn't want to move to Florida and then spend almost 2 years opening a practice, which I ended up doing anyways. So I wanted to just buy a practice that I could take over right when I moved here. When that didn't work out, I decided to go the other direction and start it. There's advantages to both ways. The advantage to buying a practice is it's a lot safer. You're buying an existing patient base. You're probably going to take a paycheck home month. I mean, you should take a paycheck home month one, as long as you buy a good practice. Startups are a lot more work, but you really get to put all of you into a startup. You really get to make it your practice from day one. You get to set the tempo, you get to set the vision, you get to hire the people that you want to hire. So, eventually buying a practice, you can mold that into that. But it takes a long time, I think, to really get there.
Is RCT prep a type of lubricant or is it something else?
RCT prep?
Mm-hmm.
RC prep. Yes. Yeah. That is another lubricant you can use.
Interesting. How did you get into cosmetic dentistry? Dental schools train you to become a general dentist. So what did you do to be where you are?
Yeah. So, again, there are dentists that like to do full mouth cases and veneers and, just basically I consider cosmetic dentistry anything that really improves the patient's smile. So I even consider whitening part of it. I consider Invisalign part of it. And the nice thing is, when you're doing the full smile makeover, it's not just Invisalign. So like if you're an orthodontist, you can get their teeth really straight, but that's like the end of it. And, when you're a general dentist and you do the Invisalign and you straighten the teeth and you whiten the teeth, then sometimes you need to do veneers or just little bondings, little composites. Sometimes it's even just manicuring the edges of the teeth because they're just a little bit uneven or something like that. But it's like the whole project. And then, seeing that before and that after where just it really pops, the difference. I think that's really what cosmetic dentistry is.
All right. Thank you so much, Dr. Vallo. I'll put the quiz in the chat for everybody to take. And with that, I think we can end the session. But thank you very much, Dr. Vallo, for your time. It was a very informative session.
You're so welcome. I was really happy to do it. I went to as many of these type of things as I possibly could when I was in dental school, and it really did give me a jump start on my career. So I commend everybody that's here. You're doing the right things already. And I wish everyone the best of luck. And, if anybody has other questions or wants to reach out, you guys are welcome to reach out to me on social media. And I'm happy to help in any way I can. So.
All right. Yes. Thank you so much again, Dr. Vallo. Everyone, Kathleen just posted the link to the quiz. You can also find it on the Linktree and our GroupMe. Thank you again, Dr. Vallo. We really enjoyed your presentation. Thank you so much for being here with us tonight. And for everyone tuning in, make sure you guys join us on Thursday. All right. I hope you guys all have a great